Hi, my name is Richard Garcia and my method of contraception is oral contraception, otherwise known as the birth control method, birth control, or simply the pill. This is one of the most popular methods people choose. In this presentation, we will discuss how the pill works, how to use the pill, failure rates, the costs, advantages, side effects, what sexually transmitted infections it protects from, and finally, how to go about obtaining it. An easy way to understand how oral contraceptives work is to simply think that it makes the body think it is pregnant. What it does is it thins the endometrium, otherwise known as the mucus lining the uterus, to prevent the implantation of an embryo. It also thickens the mucus in the cervix, making it hard for sperm to enter the uterus to begin with. There are several presentations in which birth control pills are given to you, and it is all according to your physician's best judgment. As you'll learn later on, whether the pill can be acquired over the counter or not is sort of a gray area. You can only be prescribed birth control pills, yet can buy emergency birth control, also known as Plan B or the morning after pill. The pills come in packets of 21, 28, or 91 and are to be taken every day with food or milk. It is to be taken at the same time every day. If you have a 21 pack, it looks like this. You have to take one daily and then none for 7 days. If you have a 28 pack, take one every day and then start over as soon as you finish. Remember that you can't start whenever you feel like it. You must start on the 1st or 5th day of the menstrual cycle. The 91 pack, also known as the extended regime, is to be taken one daily and then start over from the top the next day after you finish. Each pill in all of the presentations is loaded with specific balances of active ingredients. It is important not to interrupt its use. The pill is designed only to work if taken every day. Don't stop taking contraceptives without talking to your doctor first, even if you start getting spots or bleed or have an upset stomach or have any other, or if you're beginning to feel sick. The scary part is that the pill is not foolproof. In perfect use, meaning a closely monitored study, pregnancy rate was at 0.3. In typical use, meaning people who said they took it but were not monitored and had external factors affect the consumption of it for one reason or another, the pregnancy rate was 8.7. That means that by the 12th time you put the contraception to use, you will most likely get pregnant. This is still half, however, compared to the typical use of the male condom, which is at an unsettling 17.4. According to Planned Parenthood, birth control pills are easy to get with a prescription, are safe, easy, and convenient, and cost about $0 to $50 each month. Taking the pill is simple, safe, and again, according to Planned Parenthood, many women have said it improves their sex lives because it makes them feel more spontaneous. It also, however, can reduce menstrual cramps, make periods lighter, and offer protection against pelvic inflammatory disease, which often leads to infertility. However, there are negative aspects as well. By being one of the most comfortable methods of contraceptives, it has little disadvantages compared to other methods, most notoriously having to take a pill every day, for the people that get bothered by doing this or having to remember. Some negative side effects include bleeding between periods, breast tenderness, nausea, and vomiting. It's important to realize that oral contraceptives do not prevent sexually transmitted infections. Condoms are necessary for this. The birth control pill is not a recommended method of contraception for those who do not have just one partner and know for sure they will not get a sexually transmitted infection. So again, no protection. Finally, to go about obtaining birth control, you need a prescription. This means you'll have to go to your healthcare provider, be it your doctor, a clinic, or Planned Parenthood, and get a medical exam if you need one. Once you have the prescription, you can go to almost any pharmacy, such as CVS, Walgreens, or Target Pharmacy, and with your prescription in hand, buy birth control pills as instructed by your physician. As previously mentioned, in the unfortunate event of an emergency, you may buy Plan B over the counter. Note that this is not to be used regularly as a substitute for birth control. It's dangerous to do so. Thanks for listening. I hope you liked the video and found it very informative.